Hi, we would like to introduce the Department of Sports Medicine and Surgery at Manipal Hospital Whitefield today. So I am Dr. Ayyappan Nair. I specialize in shoulder surgery, sports surgeries, and I head the Department of Sports Surgery and Medicine. Today I would like to introduce to you Dr. Shishir. Dr. Shishir has recently joined us. He is a sports physician. So today we'll be discussing with you like what is the entire spectrum of sports surgery, sports medicine, the entire thing we'll be talking to you. Dr. Shishir, can you introduce about yourself?
Hello everyone, I'm Dr. Shishir. I've recently joined the sports medicine team of Manipal Hospitals. I finished my MBBS from Davangere and then I went on to finish my MD in sports medicine from Sri Ramchandra, where I was conferred the gold medal as well.
What is the motto of our Department of Sports Medicine? So the idea is that the injury is only one part of the spectrum. Today we are giving you the entire spectrum of sports sciences through this department at Manipal Hospitals. Dr. Shishir, what do you think that, in today's era, we have different categories of athletes. We have professional athletes, we have amateur athletes, we have the occasional athlete. That means, what are the things which we normally overlook? What is that we can contribute here from sports sciences?
There are aspects wherein medical issues like exercise-induced bronchospasm or anemia could be affecting their performance. Issues such as postural imbalances, which is affecting their mechanics, could be causing dip in performance, or improper nutrition could be affecting their performance. These are aspects which are often overlooked, and we are at least trying to bridge that gap in bringing that about with our team at Manipal Hospitals. So what was the idea of starting this sports medicine department at Manipal? What led you to start this unique initiative?
So me being a sports surgeon and having operated on operating last 15 years, so what I've realized is that whenever there is an injury, there is a cause to the injury. That's maybe because there is some underlying thing which is deficient in that patient. If you are treating a person only from a surgical perspective, we're not looking at that part. That is number one. So I felt that you need to correct the underlying cause. If you counsel somebody, tell somebody how to prevent it, that is the part of sports sciences or medicine which I felt was really required. So we wanted to establish this niche field called a comprehensive sports science or sports medicine field on to prevent injuries and how to help people with, as we were discussing earlier, with their basic mechanics, medical issues, to optimize them.
What kind of athletes or patients can benefit from coming to our department? Who can avail our services?
So, the services in this sports science or sports medicine starts from the common man, the person who's like going to gym, a homemaker who's going to gym, who's starting his workout. For example, at 40, you are starting to do yoga or Zumba. You could be a boxer, you could be a calorified artist, you could be a badminton player. We have the entire gamut of services, isn't it? Okay. Starting from rehab, conditioning, psychology, nutrition. Then the last part is the surgery. This is a place anybody who wants to go into any kind of sport can come to, even for a general question.
So let's say an injury does happen and it does require surgeries. Now, what advanced surgical cases have you pioneered in the treatment of sports?
We pioneered in, for example, biceps tenodesis. We are the first to do something called as arthroscopic letarge for shoulder dislocations. We do cartilage repairs in rotator cuff repairs called as SARs, CT-based calculations. We have done so much of research work at Manipal Whitefield that now we are able to optimize things to really benefit the patient.
What has been one of your most rewarding cases so far?
So there is one particular athlete who is a volleyball player. He already had 2 dislocation surgeries for the shoulder. Again, in 2 years' time, the patient had another episode of dislocation. Then he dislocated again, one more time. He came to me and we did the arthroscopic letarge. So when we were operating, so we found quite a bit of soft tissue insufficiency was there. We also found that there is significant cartilage damage. I did a technique called arthroscopic letarge. So we were the first few in India to start doing the arthroscopic letarge. The patient never dislocated after that and went back into full sport.
What does the recover process generally look like for these athletes, and what do we do here at Manipal which sets us apart?
I believe in hand holding the patient. My philosophy is always that we're just not operating. Follow up a patient till they are 100% all right.
Now, how do we approach that? How do we approach such complex trauma cases?
Any complex trauma can be broken down. For example, if you have a complex knee trauma with a knee dislocation, first you reduce it. Then you do a single stage or a stage reconstruction. You do a cartilage repair along with it. And then definitely you can put it back. So that's why when we look at our, touchwood, by God's grace, our results have been quite good. Our patients who come with recurrent failures are very less. So Dr. Shishir, so what is your approach?
I tend to look at the athlete as a whole. So I tend to assess the entire kinetic chain to see what is the predisposing factor for that injury. My approach often is trying to address the structural issues as well, at the same time addressing the root cause.
So how do you handle return to play decision?
We have to ensure that is he able to meet the power generation standards? Is he able to balance his body? Is his lower body able to handle or control his upper body? All of these we test through a structured battery of tests before clearing these athletes to go back to sport. We look at the mental health aspect as to how it is affecting their performance and train each part of it before they go back to sport.
Your research has extensively, been in technique analysis.
Correct.
In hockey.
Correct.
What lessons from that do you bring to your clinical practice?
And what I feel is understanding the specific demands of the sports is very important. As clinicians, we need to understand what is the sport demanding from these athletes. It can be a small difference, but at an elite level, these small differences are the ones which make you get selected into the Indian team and not. So these are aspects which I try to integrate from my research experience into my clinical practice as well.
How do you prevent then injury? Is there a way of assessing it?
Right. So as the old saying goes, prevention is better than cure. We often run these injury surveillance programs. Now these are in the form of assessing correct movement mechanics, assessing correct landing mechanics. Apart from that, looking at strength asymmetries. Over a period of time, this can present as overuse injuries among normal individuals or athletes for that matter.
So, a lot of people, cardiac arrests are very common in the gym. How can we avoid it?
Major governing bodies of sports advise undergoing something called as a pre-competition medical assessment. Now this is a battery of tests where the physician assesses this athlete along with certain simple tests such as an ECG and echo. Now, this helps us screen for any underlying cardiac issues which are lurking in the dark. Now if these problems are detected and these are screened, that's when our expert cardiology team comes in and they can handle it.
We have, we are starting our Department of Sports Medicine and Surgery at Manipal Hospitals, and Manipal Hospital Whitefield is going to be the first such center in advanced sports sciences. We are here to have the entire spectrum from nutrition, psychology, prevention analysis. So all this, the entire spectrum we have under one roof at Manipal Whitefield. So if you ever want to reach out to us, you can always, we're there to help you. Thank you so much. Thank you, Shishir.
Thank you.